We're finishing the malaria module. I just want to highlight the key messages and the take-home messages for malaria in emergencies. So when we think about the populations in high risk of mortality, we need to divide it into high burden regions, which are mainly children under 5 and also pregnant women. But during epidemics or emergencies, we need to take into account the whole population when we want to plan a malaria intervention. We need to also think about triggering factors, the vector control related transmissions. What are the mosquitoes adapted, the high temperatures, the heavy rains, the floods? When there are no vector control measures, this is when we will face high mosquito densities, and this is when we need to focus interventions also in vector control. We need to think about the population movements, as I've mentioned before, from non-endemic areas to endemic areas and the other way around. When there's a breakdown of health services because of different context aspects like armed conflict areas, we need to take that into account, and we need to. It's very important that the population have free access to the diagnosis and treatment of malaria. We need to take into account again the epidemiological photo of the country where we're working, so other epidemics, malnutrition, and hunger gaps to be taken very much into consideration to prepare ourselves also for malaria outbreaks, and the decreased patterns of efficacy of first-line anti-malaria treatments. As we've mentioned as well, along the module, there is resistance of anti-malarial drugs already reported in the Mekong region in Southeast Asia, and this is a public health threat into African settings where we have the majority of the cases and the majority of deaths reported on yearly basis. So for suspicion of malaria emergencies, what is giving us the alert to prepare ourselves for an intervention is to focus on the indicators, like we always do. So when we see an increase of cases in external consultations and an increase of admissions in the hospitals attributed to malaria, we need to start thinking that there may be something wrong and we need to prepare ourselves. When we have a high proportion of rapid diagnostic test positives in the communities, or that are different to the precedented years, we need to think about that there may be a malaria emergency. When we have higher proportion of age groups affected, also we need to take those elements into account. And of course, when we have a high increase of case fatality rates and mortality in the facilities, we also need to think that we need to prepare ourselves. When we compare the malaria proportional morbidity inside the hospital and in the external consultations, when we have a higher pattern when we distribute the different diseases, then we also need to take that into account. So finally, for the malaria interventions as intervention criteria, we need to take into account what is the capacity of the health services to cope and get ready for that and prepare ourselves to increase as much the capacity. Of course, doing the centralization of care at community level, at primary healthcare level, and at the hospital level, and link all of them through a good referral system. And we need to focus, as in all emergencies, with the life-saving components, which is, again, the referral system needs to be in place to refer as soon as possible the severe patients into the hospital to treat the complicated and severe cases and have a safe blood transfusion capacity. The case fatality rate is a key mortality indicator in all epidemics. Remember that it reflects the quality of case management and the access to healthcare and the severity of the disease. So we need to investigate why do we have high case fatality rates, and our goal is to decrease these case fatality rates when we do the interventions. And vector control measures and pharmaceutical preventive measures can be operational and logistically possible during emergencies. So we need to really coordinate the medical and the logistic teams with the health promoters to make sure that all the measures are in place to have an impact. To follow better this module, you can complement information if you're interested more in malaria with the following bibliography that you have on the screen. And this is the end of the malaria module. I hope you understood better now what is the disease about and how do we do interventions in malaria emergencies. Thank you very much for your attention.